Hi, I'm Dr. Gorman. I wanted to talk today a little bit about hip issues, in particular chronic hip pain. Whenever we deal with chronic pain of any sort, we're always trying to identify what are the root causes. The more chronic something is, usually the more chronic things there are, or there are more causes to it. It becomes more and more complicated. Sometimes it's actually quite simple though. When it comes to hips, we would, just like anything else that's an orthopedic or musculoskeletal issue, we're going to look at it very similar to an orthopedic surgeon, to a physical therapist. As a chiropractor, we're going to look at the hip itself, sometimes take x-rays. We want to certainly know what's going on in there relating to arthritis and degeneration and things like that. We don't want to miss the obvious. In my 18-year career, I've probably had 7 or 8 people that I've had to recommend get a hip replacement. Thankfully, they all went great. We're thankful and grateful for some of the great technology, but we also only want to do those types of things as a last resort. When it comes to chronic hip pain, one of the things that we also look at is if the pelvis or if the low back is out of alignment. Very often that will refer pain to the hip, especially nowadays with people sitting more than ever. We end up, if the pelvis or the low back is rotated in either direction, and then we sit, when we sit, we put 10 times more pressure on the discs in our low back, and we're also putting significantly more pressure on the hip itself. If it's perfectly balanced, that's okay. It's designed to withstand that force. If it's not, then we start getting irritation, inflammation, arthritis, and things like that. So first and foremost, we look at that. But I also want to talk about a very common issue with the hip that is often overlooked because most people don't know about it. And around the hip, the main muscle that actually holds the hip socket in place is a muscle called the tensor fasciae lata. Fancy name. Sometimes they call it the TFL for short. That muscle is right on the side of our hip. And if that does not work right, when we walk and when we do things, it does not support the hip right. That particular muscle actually has a direct connection with your large intestine. So I literally will be with a new patient and ask them 3, 4, 5 questions about their hip. Did you have any trauma? Do you have any falls, any accidents, trying to decipher, where direction do I need to go with this hip? Inevitably, almost all the time, I'll say, hey, by the way, tell me about your digestive problems, gas, bloating, indigestion. Are you on any medications for that? And they'll always look at me and go, well, yeah, but how did you know? And so it's a very common thing, especially in today's society with so much stress, so many bad foods, processed foods. Most people's digestive systems are not doing well at all. Even if you're on medications for that, that just masks the symptoms, why the other related things, including the hip, actually get worse and worse and worse. So in our office, we're going to look at everything like we do. We're going to evaluate the brain because that runs the show. We're going to look at physical, chemical, and emotional stressors and try to identify which ones are related to the hip. In the hip case, we want to look at the low back and pelvis. We want to look at above and look at the neck. We also want to look at the feet. If you've got flat feet or rotated feet, that can also impact the knees and the hips. So when we talk about holistic chiropractor, we're trying to look at all of you, above, below, inside, out, referred pain from the intestines with whatever complaint you have. So for more information on this and other things that we do, please check out our website, gorman-health.com, or our YouTube channel. Thank you.